Insulin was invented in 1921. For over 100 years, pharmaceutical companies sold it to diabetics as the only answer. Inject, monitor, repeat, every single day. For life. Last year, a hospital in Shanghai made insulin unnecessary. You probably didn't hear about it. A 59-year-old man had lived with type 2 diabetes for 25 years, multiple daily injections, a kidney transplant in 2017, a pancreas that had essentially stopped working. In July 2021, a surgical team at Shanghai Changzheng Hospital injected lab-grown cells into his body, cells built from his own blood, reprogrammed in a laboratory. 11 weeks later, he stopped needing insulin. 1 year later, he stopped taking all diabetes medication entirely. He has been completely drug-free for 33 months. This is not a clinical theory. This is not a promising animal study. This happened. It was published. It was verified. And almost nobody talked about it. The idea that took 2 decades to prove the science behind what happened in Shanghai starts with a question that sounds almost philosophical. What if a cell could forget what it is? Every cell in your body, a fat cell, a blood cell, a skin cell, carries the exact same DNA. What makes them different is not their genes. It is which genes are switched on and which are switched off. In 2006, Japanese researcher Shinya Yamanaka won the Nobel Prize for showing that adult cells could be rewound, returned to a state where they could become almost any other cell type in the body. A fat cell, reprogrammed, becoming a heart cell, a blood cell, reprogrammed, becoming a neuron. The problem was how he did it. Yamanaka used viruses to deliver the reprogramming signals, effective in the lab, too dangerous to put back into a human being. That is where Professor Deng Hongwei at Peking University spent the next 2 decades. He replaced the viruses with small chemical molecules, substances that enter a cell and shift its internal chemistry without touching its DNA. Safer, more precise, and critically scalable. He called the result CiPSCs, chemically induced pluripotent stem cells, adult cells, chemically convinced to forget what they were and become whatever the body needs. In the case of diabetes, what the body needs is one thing: insulin-producing beta cells. What the Shanghai team actually did. The 59-year-old patient had lost most of his pancreatic islet function after decades of type 2 diabetes and a kidney transplant in 2017. His own pancreas was no longer capable of doing its job. The team at Shanghai Changzheng Hospital, led by Dr. Yin Hao, director of the hospital's organ transplant center, took a different kind of cell from the patient, peripheral blood mononuclear cells, drawn from his own bloodstream. Those cells were reprogrammed into pluripotent stem cells using the chemical method developed at Peking University. Then, they were guided through a multi-stage differentiation process until they became 3D clusters of insulin-producing islet tissue, built in a laboratory, from the patient's own blood, transplanted back into his body in July 2021. The operation was minimally invasive, no major surgery, no donor organ, no long recovery. 11 weeks after the procedure, his body was producing enough insulin on its own that external injections were no longer needed. By 1 year, all oral diabetes medication had been withdrawn as well. Pancreatic islet function, confirmed by follow-up examinations, was effectively restored. Kidney function remained normal. Diabetic complications showed no progression. Dr. Yin described the outcome directly. The treatment can avoid the progression of diabetic complications. Not just reverse the diabetes, stop the damage that decades of diabetes had been doing to the rest of the body. This was not the only case. 3 months before the Shanghai result went public, a separate team at Peking University published a different but equally significant case. A 25-year-old woman had lived with type 1 diabetes for over a decade. 2 liver transplants, 1 failed islet transplant, daily injections since her teens. In June 2023, Professor Deng Hongwei's team injected 1.5 million lab-grown islet cells into her abdominal muscles, cells made from her own fat tissue, reprogrammed and rebuilt in the lab. 75 days later, she stopped needing insulin. 1 year later, insulin independence was stable. 2 years later, it remained stable. Professor Dung called it, on record, a functional cure. Time magazine named him to its 100 health list in 2025. 2 patients, 2 different forms of diabetes, type 1 and type 2, both reversed, both verified, both in China, both in the same 2-year window. Why you didn't hear about this drug that reverses diabetes would generate billions of dollars in revenue for the company that developed it. A cell therapy that uses the patient's own cells and potentially eliminates the need for medication entirely generates a different kind of conversation. The global insulin market is worth over $20 billion a year. Diabetes management devices, monitoring systems, and medications combined represent nearly $100 billion in annual revenue worldwide. None of that disappears overnight. But a verified, published, peer-reviewed proof of concept that diabetes can be functionally reversed in 2 different patients with 2 different forms of the disease using the same core technology is not something that moves slowly through the news cycle. It moves slowly because the people who would normally amplify it have reasons to be cautious about what it implies. What comes next? The remaining challenge is scale. Both treatments use the patient's own cells. That makes rejection almost impossible. The immune system recognizes them as self, but it also means every treatment is custom-built for one person. You cannot manufacture it in advance or distribute it at volume. Research groups in China are already working on the next step. Universal donor cell lines. Stem cells engineered to be invisible to any immune system, so one batch of lab-grown islets could treat any patient, regardless of their biology. In August 2025, Professor Deng's team published another breakthrough, the first successful differentiation of human pluripotent stem cells into fully complete islets, containing not just beta cells, but every cell type a real pancreatic islet has. Alpha cells, delta cells, PP cells, all present, all functional, responding to blood glucose changes exactly as a real pancreas does. Not a patch, not a workaround, an exact biological replica of what was lost. The pipeline from that result to a scalable, widely available treatment is not a straight line, and it is not short. But the proof that it works, in human beings, with verified results, now exists.